All right. Thank you again, everybody, for joining us today. I am so pleased to welcome you to the National Alliance to End Homelessness's uh, State of Homelessness 2024 edition webinar. My name is Daniel Soucy. I am a research analyst with the National Alliance to End Homelessness. Um, Before we begin today, I would like to begin with some quick housekeeping notes. This webinar is being recorded, and a copy of the webinar will be distributed to everyone who is registered following today's event. It is open to the public, so please know that members of the media may be in attendance and that the webinar is on the record. Please feel free to use the Q&A function for questions. We have Alliance staff who will monitor these questions and ensure that the panelists have a chance to respond to as many of them as possible. So today, in addition to sharing trends in homelessness across the United States, I'm also excited to welcome three fantastic leaders from across the country who will help us focus on solutions, what can and what is being done across the country to end homelessness. We are so thankful to each of these leaders for joining us today and excited to learn more about how they reduced homelessness in their communities. So I'm going to go ahead and share my screen for everybody. Hopefully folks can see that. Let's get started. So a little bit about the State of Homelessness Report. To develop the report, we use data from part one of the 2023 Annual Homelessness Assessment Report to Congress, other Department of Housing and Urban Development data, as well as publicly available census data. Our goal with the report this year was to format the data in a way that improves its accessibility for practitioners, policymakers, and reporters, while also telling an evidence-driven story of homelessness trends in the United States in 2023. Our goal for today is to walk through this story by offering an analysis of some key national trends. And like I said, after this introduction, we'll be in conversation with three leaders who are meeting their community's needs by embracing the effectiveness of housing and services to reduce homelessness. After today's webinar, we also encourage you to look at the report and interact with the visualizations to learn more about the data in your local community. So what is the data saying at the national level? From 2022 to 2023, the majority of communities saw increases in homelessness. In large part, this is because first-time homelessness increased 22%, leading more people to experience homelessness for the first time than ever recorded since data collection began. And I want to be clear about what this means. It is both an indication that people are feeling the strain of high housing costs and insufficient income supports, and a sign that the homelessness response system is not receiving the resources it needs to meet this growing need for services. Still, the homelessness system is responding. In 2023, frontline workers connected more people with shelter and housing than the number who had no option but to sleep outside. The number of permanent housing units and temporary shelter beds increased more between 2021 and 2022, as well as between 2022 and 2023 than any previous single year increase. And fewer people are returning to homelessness once they exit. Unfortunately, the response system can only do so much with what it is given. Nationally, more resources are necessary to meet the demand for services. Using the visualizations in the report, you can compare the number of beds in the United States, your state, or your local community with the number of people experiencing homelessness. There are consistent shortages in available emergency and permanent housing assistance resources for people in need. The data is clear. Supply is not keeping up with demand. For people keeping an eye on housing and homelessness trends, this is not surprising. For many years, investment in building and preserving affordable housing for people with the lowest incomes have not met the United States needs. As the Alliance's Research Council member and professor at the University of Washington, Dr. Greg Colburn states clearly, homelessness is a housing problem. We know that the communities with the least affordable housing are also the ones facing the highest risks of homelessness. Therefore, in our analysis, we tried to estimate the number of income-poor renters who pay more than 50% of their incomes on rent, or otherwise known as severely housing cost burdened. More households than ever are living in this unsustainable reality. In addition, 3.4 million households are living doubled up out of financial necessity. In other words, they live in overcrowded housing because they cannot afford a place of their own. While we analyze these risks among the poorest renter households, we should also be clear that outside research indicates that signs of housing instability are also rising among mid to high income households. You will also notice in our visualizations in the report that a larger proportion of people experiencing severe housing cost burden and are doubling up in specific states. So the bars with the darker colors and the darker shades are where a larger proportion of the state's lowest income population are living doubled up or paying too much on rent. These charts also get to the heart of the problem, which is that widening gap between low-income households and the cost of living, specifically the cost of housing. More fundamentally, this data demonstrates that to end homelessness in the United States, we need to expand and preserve permanent housing that is affordable to people with the lowest incomes. We also need to ensure that people have access to the health and income supports they need to remain stably housed. Without robust funding for these solutions, people will continue to experience homelessness, and the data in 2023 is very clear. Specific groups have long faced additional barriers to accessing stable housing and incomes in the United States. Individual and systemic discrimination, unfair treatment in housing, employment, and assistance programs all mean that many groups of color, people who identify as transgender, gender questioning, and not singularly male or female, as well as disabled people, face more barriers to accessing and remaining in temporary and permanent housing. As a result, many of these groups also face higher rates of overall homelessness and are less likely to access safe shelter. Additionally, for the first time, the Department of Housing and Urban Development published detailed age categories of people experiencing homelessness. This highlighted a concerning trend that policymakers, advocates, and providers must work to address. 20% of all people experiencing homelessness on a single night in 2023 are now above the age of 55. As people experiencing homelessness grow older, healthcare, accessible housing, and supportive services must grow to meet the needs of every older American, regardless of race, gender, income, ability, or geography. Using our visualizations, you can look at more specific data across the United States. Our report shows that 20 out of 10,000 people experienced homelessness on a given night in January 2023. However, 171 Native or Pacific Islander people, 83 American Indian, Alaskan Native, or Indigenous people, and 59 Black or African American people per 10,000 people experience homelessness. It was also notable that for the first time, Asian households saw the largest increase in homelessness from 2022 to 2023. To end homelessness, states and communities must understand their local disparities and offer targeted assistance to the groups that are most impacted. All states need to expand housing and services for people experiencing homelessness. That is clear. However, just 7 states account for 63% of people experiencing homelessness in the United States. By hovering or clicking on the visuals available in the report, you can see that our analysis indicates that some states have larger numbers of people experiencing homelessness relative to their population size. Oops, sorry about that. Resources can be strategically targeted to meet demand in these places, but these states must also act locally to ensure that deeply affordable housing is preserved and expanded, and that people have access to the income and health supports they need to thrive. So these trends can obviously be discouraging to all of us who care about this crisis, but as service providers and experts know, decreases in homelessness are not only possible, They have happened and they continue to happen in communities across the country. Some examples include from 2020 to 2022, fewer families had to sleep outside or in shelter. And from 2017 to 2022, more youth could access the housing they needed to jumpstart a productive and healthy life. Congressional funding also made it possible for the Department of Veterans Affairs and the Department of Housing and Urban Development to expand and sustain investments in housing and health services for veterans. A VA analysis found that this coordinated effort and adherence to a housing-first approach led to a decline of 55.3% in veteran homelessness from 2009 to 2022, compared to just 8% among the comparison population. However, from 2022 to 2023, homelessness increased among all of these groups again. In 2023, years of housing shortages and rising living costs caught up with people and hit communities hard. Large amounts of pandemic-era assistance ran out. But it does not have to be this way. It is clear that we are in a pivotal moment, one where we must double down on investments in deeply affordable housing preservation, supportive services, and income supports that drive these numbers down. So thank you to everyone attending today for bearing with me as I walk through what's happening at the national level. There's a lot more data available in the report, and we really encourage you all to go explore it, specifically related to your local communities. And now I'm excited to introduce our panel so that they can dive deeper into what we all want to know about, which is the solutions. So first, I'd like to introduce Mackenzie Kelly, who is the Executive Director of the Chattanooga Regional Homelessness Coalition, or CRHC. At CRHC, Mackenzie oversees the strategic direction, operations, and funding to address homelessness in Southeast Tennessee. Since joining CRHC in 2021, Mackenzie's leadership and dedication have driven significant progress in the organization, positioning it as a national model in coordinated homeless response and community engagement. She has also secured key partnerships and additional funding, including a strategic partnership with the city of Chattanooga. Welcome, Mackenzie, and thank you for being here. Sarah Kahn is president and CEO of Housing Forward, a leading organization committed to fighting homelessness in Dallas, Texas. Sarah previously was the CPO of Housing Forward, and before Housing Forward, Sarah worked at the Cloudburst Group, a contractor for the U.S. Department of Housing and Urban Development for 5 years. There, she oversaw the homelessness assistance and housing programs. Housing Forward also leads the All Neighbors Coalition, which includes more than 140 organizations in Dallas and Collin counties. As of November this year, Housing Forward and the All Neighbors Coalition succeeded in finding permanent shelter for some 2,800 previously unhoused individuals in Dallas and Collin counties. Wow. Welcome, Sarah, and congratulations. That's amazing. Dr. Robert Ratner is our final guest today. Dr. Ratner is a public health professional with more than 20 years of experience working on housing as a health issue. His work experience includes serving as the supportive housing director or program director at a community health center, and over 13 years as a housing services director in a county behavioral health department. He became the director of the Santa Cruz County Human Services Department Housing for Health Division in November 2020. The division provides staffing support to the local housing and urban development continuum of care, focused on bringing community members together to ensure all county residents have stable, safe, and healthy places to live. In his various roles, Dr. Ratner helped establish 2 integrated health clinics for individuals and families with histories of housing instability and homelessness. He led efforts to expand permanent supportive housing for seniors, disabled people, and households experiencing homelessness. Welcome, Dr. Ratner, and thank you again, everyone, for being here. Finally, my colleague and co-author on the State of Homelessness Report, research analyst at the National Alliance to End Homelessness, Andrew Hall, will be leading today's conversation. Thank you again, everyone, and I'm so looking forward to this conversation.
Thank you, Daniel, for that wonderful overview of our report findings and for the introductions. Now we're going to transition into the discussion portion of our presentation. Just as a reminder, you may enter your questions in the Q&A box at the bottom of your screen. So let's kick off the conversation by briefly describing your community, what trends you're seeing in your community, and how it might be different or the same from the national trends. So let's start with Mackenzie.
Thank you. Um, as Daniel said, I'm Mackenzie Kelly. I'm the executive director of the Chattanooga Regional Homeless Coalition, which is the COC lead for Tennessee 500, Chattanooga, Southeast Tennessee, COC. So we cover an 11 county region in Southeast Tennessee. Chattanooga is our major urban city in our COC with just less than 200,000 people. Our total population of our COC is right under 400,000. So we're dealing with a pretty populated area, mid-sized city, and then 10 other very rural counties. During the pandemic, we saw significant increases, 40 to 50% increases in our unsheltered and sheltered numbers. And then turned around, and in 2023 we saw about a 40% decrease, and we're kind of back to those pre-pandemic numbers. We saw a slight decrease again this past year, but holding pretty steady over the past 2 years. And we think that a lot of this reduction is in part to some key partnerships that I'll be able to talk about a little bit later. But then also some overall just system improvements, kind of a complete overhaul of the system that I'm excited to tell you all about later.
Thank you. And Sarah.
Hey, everybody. Good to be with you this afternoon. I am Sarah Kahn, and I'm the CEO of Housing Forward, which is the lead agency for the continuum of care of Dallas and Collin County. We're also the backbone agency for the All Neighbors Coalition, which is about 150 public, private, and nonprofit organizations that are all kind of working in coordination to solve homelessness in both of our counties. So our trends are different than the national trends. Between 2015 and 2021, our system saw an increase in demand for homeless services. And during that time period, we really met that demand by substantially expanding emergency shelter and transitional housing beds, while we were really underinvesting in permanent housing pathways, such as rapid rehousing, permanent supportive housing, and diversion. And the result was between 2015 and 2021, unsheltered homelessness more than tripled, and overall homelessness skyrocketed by about 45%. So as demand for homeless services was increasing, we met that demand with interventions that weren't really solving the problem. And so in 2021, we embarked on a community-wide overhaul of the homeless response system driven by the community, which included community members and service providers coming together around a shared vision and shared goals, with a particular focus on reducing unsheltered homelessness, veteran homelessness, as well as family and youth homelessness. The community then leveraged public and private partnerships to align funding to increase and expand pathways to permanent housing and supportive services, with a focus on also promoting racial equity. And so we made a shift as demand for homeless services continued. We met that demand by investing in interventions that help people quickly exit homelessness. And so since 2021, the result has been a 24% decrease in unsheltered homelessness, a 19% reduction in homelessness overall. And we accomplished that by housing over 11,000 individuals and people and families since 2021. And now our system is housing on average about 430 individuals a month. So that change to our approach to align investments and expand rehousing capacity within our community really helped us kind of turn the battleship and start seeing our numbers go back in the other direction.
That's great. Thank you. Robert? I can repeat the question if you'd like.
Oh, no, I got it. Thanks, Andrew. Thank you for having me. My name is Robert Ratner. I work in the County of Santa Cruz in government, actually in the Human Services Department, but our team also helps manage our COC, and we have a name of Housing for Health Partnership. I think a theme from all of us is like partnering and bringing organizations together to work together on this issue is really key. For those of you that don't know the county, we're considered a mid-sized county, one of 58 in California. We're a coastal community, but we're nestled between what's called Silicon Valley and Monterey Bay. So the Bay is Monterey Bay. We're known for having a world-class university, tourist town. A lot of people don't know we have a really strong agricultural work sector in the southern part of our community that often gets forgotten about and neglected in a lot of our messaging. Our housing market, unfortunately, like the other things that people often know about Santa Cruz, surfing, progressive politics, and beautiful landscape to live and work and play in. But our housing market is really tough. So the National Low-Income Housing Coalition does a report called Out of Reach, and for the last 2 years in a row, we're the most expensive rental market in the country. Two-bedroom unit in our community goes for $78 an hour for a full-time worker. And so you have to, the average wage in our community, you need 3.5 jobs to afford a two-bedroom apartment. So housing affordability is a huge challenge for us. 1/3 of the people who live here are eligible and enrolled in Medicaid. So folks living on fixed incomes. Where we've had the most success locally in reducing homelessness is during the pandemic, the influx of new resources and the level of coordination we were able to pull together helped us get more people into shelter. We have a large unsheltered population, but we also really partner closely with the housing authority and service providers to match people to using housing first principles, vouchers, and we can talk more about this later. So we saw a significant reduction in homelessness as a result of those changes during the pandemic, and we've continued those for now. We've seen progress with veterans, youth, and families. We're really struggling with seniors and people with disabilities, similar to the national count. And we've seen a significant rise in homelessness among the Latino population, which is more predominantly located in the southern part of our county. So we've got a lot of work to do there. But I think the premise of our approach is like bringing partners together to work together. And I think that's how we can make progress.
Thank you for that. So now for our second question, what policies are being supported by your community? What do you feel are fundamental in contributing to some of the positive changes you've seen in addressing homelessness in your community? Let's start with Sarah.
Sorry, I was on mute. We're all of our communities, and I'm assuming all the communities on the call today are all faced with the challenge of how best to leverage very limited funding to expand rehousing in a way that allows us to keep up with the demand from year to year. And in our community, we made some important moves to be able to do that. First was setting common goals for reducing homelessness. Second is the providers actually came together to co-design a common approach to delivering services and established common program models with clear performance and racial equity measures for rapid rehousing, permanent supportive housing, coordinated outreach, diversion, housing navigation. And with that system vision in place, it became much easier to really make it a practice and a policy of our public and private partners to align their investments to that common regional design. And so that has really been, that really is the recipe for scaling pathways to housing, is everyone kind of signing up to that common evidence-based approach. And then instead of really splintering our resources among several different types of projects and interventions versus a system-wide approach. And some examples of that are in 2021, the city and the county, the city of Dallas County and our private sector partners all pooled their resources to substantially scale a rapid rehousing program in our community. Another example is just funders leveraging the COC community-wide program models in their new funding opportunities. So recently, the city of Dallas also funded 16 new outreach staff. And the expectation was in the RFP that those agencies are signing up to the community-wide coordinated outreach model. So it's a way to kind of set a policy of funders kind of jointly deciding to align to the unified approach and strategy as a way to scale those pathways out of homelessness, which have been very pivotal in allowing us to make progress. So.
Thank you. Let's go to Robert this time.
Yeah, in some ways echoing what Sarah said, I think that part of how we were able to make progress is a process of bringing key elected leaders and community leaders together. And there was a consultation that resulted in the creation of our division within the county. Historically, the County of Santa Cruz had not built up a lot of infrastructure and support for addressing housing and homelessness issues. We developed something called the Housing for Health framework that, similar to what Sarah was describing, some core principles and we do our work, and we update our plans every 6 months on what we're going to focus on collectively to make progress. One area where I feel like we've made the most impact is our partnership with our local housing authority. The emergency housing vouchers that were available during COVID, more VA VASH vouchers, and just the amazing willingness of our leaders in the housing authority to work with us to pair services with some standard expectations of how that works with the vouchers. And then landlord incentives and support for landlords has been a really great combination. I mean, ultimately, people need permanent places to go where they get the right support. So those partnerships have really made that happen. California also, I think, is unique, and we're going through some growing pains, but for people on Medicaid, or here we call it Medi-Cal, there's something called CalAIM, California Advancing and Innovating Medi-Cal. So the healthcare system is investing more in services and short-term housing resources for people who are struggling to sustain and get back into housing. So I think that's been a really important part for our success. It's also some challenges because our network of providers are not used to working in the healthcare system. So it's been a shift for us collectively to move in that direction. And then I think the last thing I'd share is that California is promoting this idea of local governments becoming pro-housing. And we have one community here that's designated the city of Santa Cruz as a pro-housing community, which essentially is a checklist of things you can do around local zoning and planning and funding to create more housing options for everybody, but especially people living with the lowest incomes. So I think that creating more housing for those with lower incomes and having more subsidies paired with services and the partnerships have really been key for us here.
Thank you. Mackenzie?
Yeah, I think that a key to our success has been a partnership with the city of Chattanooga. So 2 years ago, we entered a strategic partnership with the city of Chattanooga that has allowed us to expand resources and find some innovative ways to address our homelessness, not just in the city, but across our entire COC. So the contract has supported major initiatives financially. One of those is a flexible housing fund. So the city of Chattanooga has contributed anywhere from about $500,000 to $900,000 into a flexible housing fund over the past 3 years. And it exists to pay kind of the one-time barriers to get folks into housing. And we have seen a ton of success in that. In moving folks in, we actually are spending about $1.3 million a year just to keep that fund floating. So we're doing some development on the side and have been able to kind of leverage that initial fund to get support from other key partners, both public and private partners. Another thing that this contract has done is it's allowed support for our agency to grow. So we now have an entire coordinated entry team, a data team, and we've really been able to use that to kind of overhaul our entire system and make some improvements that I'll talk about a little bit later. And then another thing that through this contract, we had an obligation to the city to create a strategic plan to address homelessness in the community. And you know, while the actual plan itself has been really great, and I think will continue to be great in providing some innovative ways to expand resources. I think another thing that it kind of did that we weren't expecting it to do was it allowed us to really form these action teams around different subpopulations that we have found in kind of our coordinated entry overhaul, that has been a really key piece in developing some of the changes and leading into some of the case conferencing that I'll talk about later. That all kind of came from just trying to get the right folks in the room to develop the strategic plan. So I think just the entire contract with the city of Chattanooga has been instrumental in supporting us financially and allowing us to really expand our resources, but also bring some kind of unlikely partners to the table as well.
Thank you for that. So that's actually a really good segue into our third and last question. You know, we heard a lot from our panelists on partnerships that are developing across sectors, and a lot of de-siloing that's occurring. What innovations are being implemented in your community to reduce homelessness for specific communities at high risk of homelessness? And how do you think those efforts can be replicated in other areas across the country? So let's start with Robert. I remember you had mentioned earlier about youth and family homelessness, but can you start?
Yeah, thanks, Andrew. One example that I think is worth sharing is the partnership with the housing authority that we have. There's a special program called the Family Unification Program, which are vouchers that are set aside for families and youth involved in the child welfare system. And by working very closely with our child welfare department, the housing authority, we've been able to really create strong referral networks and processes to help families get access to those resources as quickly as possible. One thing in that relationship that I think is worth sharing is that we discovered that there were barriers to accessing vouchers for families that had contact with the criminal justice system. So we entered into conversation with the housing authority about making some changes to their screening policies and procedures. And I'm really proud of the openness there and the conversations we had to allow for some loosening of what were some procedures that really screen people out. And as a result, we're helping to get more families and youth into housing through that partnership. Another element of that is we created, and I appreciate what Mackenzie said, maybe it's a theme for all of us, a centralized, easier to access, one-time flexible housing fund for deposits, move-in expenses. That's been a really significant thing. We did the same with landlord incentives. We created a standard amount for landlord incentives and a landlord hotline. So it's like the case managers for landlords was part of what we developed to be successful. And I think another aspect for us is we're really trying to become more tuned in to listening to people who are experiencing our services and programs and homelessness. So it's taken us a while. We've got room to get better, but we created some positions for lived expertise groups to be a part of our decision-making and programming, both for youth and the general population. I think that's really important. And then I think the last thing I'd share is we made some changes to our coordinated entry process. We used to use the VI SPDAT, and then we decided that wasn't working for us for a lot of reasons. We developed a local assessment process, and our assessment process shifted from just assessing people to get them on a list and to get a score to assessing people to find out what's really going on in your life and what can we do to help you, and acknowledging that there are limits. We only do 150 to 200 referrals a year, so we're being much more transparent with people about if you go through this process, what's available. And the data we're collecting, one of the messages we get out is help people with what their needs are right now. Don't just get them on a list to wait. And I think Mackenzie's going to share like the case conferences and bringing people together who are doing that work and sharing resources and things that really help folks and brainstorming together, I think is also part of our success.
Sure. Mackenzie, if you'd like to go next.
Yeah. So kind of like Robert was saying, we also completely overhauled our coordinated entry system. We realized that our from assessment to referral process, none of it was really working. It was broken. It was clunky, and people were essentially just getting on a list and never moving. So we determined a couple of needs for our community. One, we needed to be making more quality referrals. We were making referrals to our programs, and our programs were not having success in finding folks or contacting folks, or they would contact those folks and realize that it wasn't a fit for the program. And then we also kind of stripped down the assessment piece to what do we really need to know about this person, this household, and to get them to a housing project that will be able to serve them. So through doing that, we were able to develop a very community-focused assessment. It's a web-based survey that is really easy to use. The assessment itself is trauma-informed, so it doesn't take some specific social worker, caseworker to be able to administer the assessment. So because of that, we've been able to form some really unlikely partnerships, including our school systems, our libraries. And so we've been able to expand access. So we've pretty much said where are people presenting, and how do we make that an access point to the system. So in trying to expand these access points, which we have gone from 3 access points with our old assessment to over 30 now. And they're all at places where folks really are actually presenting. They're not having to seek out a place to be assessed. But through all of training folks on the assessment, they're also getting a full coordinated entry training. And so we're really able to educate providers and community partners on what coordinated entry is, why it exists, and what the need for it is, and the changes that we've made to it, why it can work now. And because of that, we've been able to expand our housing programs that are now voluntarily participating in coordinated entry. So before 2 years ago, we had our 7 funded COC funded projects taking coordinated entry referrals, and a lot of times not having a lot of luck with those referrals. So almost 20 different organizations in town that are taking referrals from coordinated entry, and those referrals are quality referrals. One of the reasons that they're able to be quality referrals is because we now have a by name list that we're able to filter down very specifically into subpopulations, which was not the case before. And a lot of that goes back to that assessment. What are we asking people? We're really just asking them what we need to know to be able to filter them into these groups, which is where case conferencing has come from. So I mentioned that during the strategic planning process, we had all of these different action teams kind of based on subpopulation, just to address it strategically and have a piece for each subpopulation in that strategic plan. And we ended up, as that was happening and this new by name list was being built, we kind of combined the two, and the action teams then became kind of our case conferencing groups. And so now we have case conferencing for 6 different groups. So kind of our subpopulations of veterans and chronic and families. And then we also have some specific groups for our rural counties because they are seeing a very different kind of picture of homelessness than what folks in the city of Chattanooga are seeing. So we have somebody that is facilitating all of those case conferencing groups. And I think that has really led to a lot of our success in moving people through the system, getting all of the right providers in rooms together, and really being able to address some of the gaps that we have not been able to address previously.
Okay, Sarah, thank you for that, Mackenzie.
Yeah, I mean, interestingly, while I'm not going to talk about those strategies, I would say Dallas and Collin County have leveraged some of the similar approaches in terms of having a flex fund, having landlord incentives be really critical to the process, and reforming our coordinated access. So I am seeing a lot of common themes across our communities for how we kind of build in those centralized supports and make sure that we're targeting resources really effectively. But in our community, you know, I think the Supreme Court case, which is top of everyone's mind, I think really underscored the mounting pressure on cities and our sector to respond to encampments and street homelessness. But we all know that without a pathway to housing, our neighbors who are ticketed and arrested are going to continue to live outside, and unsheltered homelessness will remain unchanged. So that ruling really didn't provide our communities with a tool to actually reduce homelessness or to bring about change for our neighbors who are living outside, or for the community as a whole, which is calling on us to really reduce street homelessness. So in Dallas and Collin County, we've introduced a model that's I know being implemented in other continuums of care, which is a more solution-focused approach to addressing encampments, and it's the street to home encampment response model, which focuses on closing encampments by offering all of the neighbors living at that location permanent housing and supportive services. And there's a few aspects of this model which have been really critical. The first is that we are the continuum of care is partnering with local government. So in this instance, the city of Dallas, to very intentionally prioritize and target public spaces across the community for a variety of reasons, but typically those that are posing the largest public health risks, so that we can systematically close encampments together one site at a time. The second component is we are expediting the closure of those encampments by bringing comprehensive behavioral health care and rehousing services directly on site at those locations. We have been guided by people living at these encampments about how to structure that support. And so today we're bringing street medicine teams, behavioral health specialists, outreach workers, housing navigators, housing case managers, all joining on site for about 4 to 8 weeks to support our neighbors who are living at those locations to move into their own apartments, where those units are wrapped in supportive services to support people to transition back into permanent housing and to have access, if they choose, to a variety of behavioral health care supports. So after the 4 to 8 week timeline of closing that site and all neighbors are housed, then the city coordinates a strategy to ensure that those public spaces can be opened back up to the community so that they're not repopulated with tents. And then we systematically go from one encampment to the next. And so that model is different than the tools that we've had historically in the past. And the first reason is we're actually ending a person's homelessness in this situation, versus tools that we've had previously are to come with an outreach team who is offering some services and an offer of shelter, and then people are kind of asked to move along. And in that instance, we're not resolving the encampment, we're just moving it from block to block and neighborhood to neighborhood. So in this instance, we're very committed to actually resolving the encampment by ending homelessness for those that are living on site. We've also experimented with other strategies, and this strategy is much cheaper and quicker than alternative approaches that we've tried, where we've moved people into a hotel room and then moved them into permanent housing. We've had way more success by lining up housing units and resources at the start of a closure and helping people move directly into housing. It's a lot cheaper and frees up our capacity and resources to close multiple encampments at a time, versus spending a lot of money on hotel rooms and lengthening the rehousing process by several months. The third thing that we've learned that's really important is, in our experience, there's a common myth that the population who's living on encampments are service resistant. But what we've learned is folks might be resistant to going to shelter, but when we offer housing, the vast majority of the time, 95% of the time, people say yes to working with us on housing, even if they say no to shelter. And so I think over time, there's been a myth that people are service resistant, but what we've learned is when you actually engage people living on site, we realized that we were just offering them things that they didn't want. And so by offering housing and being led by people who are experiencing homelessness in their needs, that has led us to a way more, I think, effective model at closing encampments permanently.
Thank you so much for sharing all of that and for sharing your approaches and strategies for reducing homelessness in your communities. We have about 13 minutes for questions. Thanks in advance for everyone who contributed questions, and also thank you so much to our panelists for this really great discussion. Looks like we have I'm going to just go through some questions, and then unfortunately, I don't think we'll have time to get through all of them, but we'll certainly try to follow up with folks for those questions that we're not able to answer. But it looks like we have a lot of questions about the authentic engagement of people with lived experience of homelessness. So I'll start with that question. How have people experiencing homelessness or who have recent lived experience of homelessness supported solutions and programs designed in your communities? You can just jump in.
I'm happy to answer what we've been doing. I think we've been tackling this at multiple levels. One is when we're working on site, we have adapted our the structure of how we support people to rehouse out of encampments based on what we're learning from people living in those sites. And the model might look a little bit different depending on what people's needs are. But we've definitely revised that model a lot by just talking to people in real time as we're delivering rehousing assistance and care on site. The second level is we try to build in listening sessions every quarter for our main programs as part of a kind of continuous performance improvement process, having listening sessions with people that have been served by the programs. And then I think the third level is making sure that we have diverse voices as part of our work groups, which is where all of the policy and practice work happens. So we have a lived experience coalition and a YAB members that join those work groups to make sure that we're kind of fully integrating the voices of people who've experienced homelessness in the system design work.
Okay, thank you for that. All right, I can move on to the next question. I saw someone had a question about the effects of global climate change. What impact is extreme weather having on homelessness in your community? How are you tracking or supporting people impacted by climate-related events?
I can try to answer that, Andrew. We have a long ways to go to get better at this. Santa Cruz County has been impacted by a lot of unfortunate events over the past few years. We had a major fire that displaced thousands of households. We lost housing stock. We've had major flooding that's impacted housing stock and people's lives. In terms of tracking the impacts, I think part of it is doing what Sarah is suggesting, finding ways for people to really share their stories in various ways and venues. We also, in our pit count, we've started to add information on how a disaster has impacted people's housing, just to get a sense. And that number has been growing over the past few years, just understanding those impacts. And then we're trying to learn more about how to more effectively work with FEMA and the disaster response parts of our local governments to meet the needs of people who are unhoused. Part of that is in the aftermath, also taking advantage of federal resources. For example, we have Community Development Block Grant disaster relief funds that are coming to help us rebuild some of the housing that we've lost. And as part of that process, we need to make sure that there are projects for those individuals that are seniors, people with disabilities living on fixed incomes. But I anticipate it's going to be a growing challenge for many communities around the country. Because having stable, safe places to live requires that the environment in which we're living isn't going to be subject to these kinds of disasters. So we're having to rethink where we build and how we build to prevent loss of housing and displacement.
Thank you. I also saw a few questions about funding. Did any folks on this call or on the panel tell us a little bit about the innovative funding sources that you've identified and used, in your communities, specifically for immediate solutions to those in need?
I think our
Mackenzie should jump in.
I mean, I think speaking to the partnership with the city of Chattanooga, that in itself has been kind of the key one. But I think that it has really opened the door for us to use that as kind of leverage with some of our other local government, our county government, and then even looking to our school systems. We now, especially with that flexible housing fund, have some really specific data on how many school age kids we're serving, how many folks we're serving through the schools, things of that nature. We have, and so we're able to kind of go to all of our schools in the county that Chattanooga's in are actually county schools. So we're able to use that to leverage our county government as well. So I mean, ultimately, I would say it's just our partnerships with our local governments and their funding sources that have been key to some of our innovative projects.
Kind of building on that, Andrew, I think completely agree about partnering with local government. Part of how we were able to be successful is our county government stepping in and investing more in infrastructure. I actually work in government, so embedding COCs within some government agencies creates opportunities for leveraging, either in my case, human services or social services dollars, but in the healthcare sector, healthcare dollars for outreach. And so there are opportunities depending on where you nest your kind of backbone work to leverage some resources. And then I'm really excited that our local community foundation has created a pathway for private donations into our centralized housing assistance fund, because a lot of folks want to contribute to helping people get back into housing. And often they don't know how. They may have feelings about giving money to someone who's appears to be living on the streets asking for funding. But if they can give it to a centralized partner where there was a track record of tracking people moving back into housing, people are much more likely to contribute. So I imagine that all of us are doing that to some degree, to combine public and private. And I think really hard work, but braiding the funding sources together to create a program that makes sense. Really excited about what Sarah described, because I imagine pulling off the encampment response effort requires money from all these different places and getting everyone to agree to contribute to their part, but to create a whole. And that's where I've personally seen the most success, when you can get everyone to chip in with the label and the requirements of their funding to a shared objective. That's when you start to see success.
Yeah, absolutely. I mean, I think there's definitely a common theme, which is interesting across all of our communities, just about the level of resource alignment that leads to continued progress when everyone agrees on the same sets of kind of evidence-based strategies that are proving to work, and communities stay the course and expanding those strategies and agree to do that under a unified approach, I think is clearly an important strategy that all of our communities are using. I will also say in Dallas, Texas is a non-expansion state. And so we have just secured support from HUD, a HUD waiver to be able to use HUD dollars to pay a case rate for behavioral health care teams. And the idea is that we're seeding those teams and then we'll use the performance outcomes this year to eventually leverage managed care organizations to take on more of the payment under a value-based structure for those behavioral health care teams. So that's just another kind of workaround that we've thought about strategically to make up for the fact that Medicaid is not available to a large portion of our population experiencing homelessness. So it was just another way to be able to leverage some of the unsheltered NOFA funding to be able to cover that wraparound support services.
Great, thank you. I think we have time for just one more question. So for the first time this year, our State of Homelessness report was able to talk about older adults because more detailed age categories were publicly available. So how can communities ensure that housing has the supportive services necessary for many older adults disabled people and people with health conditions to remain housed.
I could jump on this one and with a couple of ideas. I'm a healthcare person, and one of the things that I think is really critical is bringing together the different split elements of healthcare and human services to really support people. It's particularly important for older adults who may have challenges with chronic health conditions, behavioral health issues, may need help with daily living skills. So pulling teams together that have behavioral health folks, in-home care workers, getting those wraparound supports that people need to be able to keep housing and maintain that housing is really critical. So I think that a theme from the conversation with us today is the partnerships that are required to make that happen. I think another issue is isolation and making sure we have in our community, we have in our department work being done to help seniors who are living alone, to connect with community events and community resources. We had a pilot project where folks were given training on how to use technology, iPads and other mobile devices to stay in touch with providers. And we recently did a study. There's a model at the federal level called the Program of All-Inclusive Care for the Elderly, which is for people who are on Medicaid or Medicare, this kind of wraparound support services for seniors and people with disabilities. So we're looking at, can we bring that particular kind of healthcare financing and support model into our community? And I think other states and communities have different structures, but PACE is a national program and model as an example of how do you get those funding sources required to get that team to really support people to live in the community as long as possible.
The other thing I would add on that we've learned with permanent supportive housing just in general is when you leave it up to individual providers to piece together the myriad of services that are required to make that project work, that's when often the supports that people need fall short because it's really hard to do. And so we've tried to move towards a more system-wide approach where we've agreed on a centralized way of leveraging behavioral healthcare partnerships and healthcare partnerships to make that support available to PSH providers in a more centralized, systemic way versus historically where we've really left it up to each provider to figure out how to piece together, multiple types of funding sources and supports and partnerships to make it work. So I think the more that we can have a sustainable, systemic solution, the better for the community.
Thank you. So we're almost at time. I want to extend another thanks to our wonderful panelists, and thank you so much to our audience for taking the time to be with us today and to hear from your peers and from the Alliance about our new report. As Daniel said at the beginning of this webinar, everyone who registered for it is going to get a recording of the webinar. And so I just want to say thank you so much again, and have a good rest of your day.
Thank you.
Thank you.